Welcome to Into the Grain podcast, where we slow down and talk about what matters. This podcast was recorded at the Hope FM podcast studio and is sponsored by P39 Adventure Gear. I'm your host, Austin Hewlett, and joined with us, as always, is our co-host and my dad, Aaron Hewlett. And on today's episode, we sit down with Dr. Galera. Dr. Galera is a medical doctor with over 20 years or so experience in the medical industry, specifically as a physician and a primary care doctor. And he's worked traditionally within the healthcare system for a while and eventually started to shift towards a more holistic approach where the focus is more patient centered on the individual and overall health and wellness. So we sat down, had a really good conversation, explored a lot of different topics. It was fun. We used him sort of as our own chat GPT for any medical related questions that we had. So hope you enjoy, sit down, dive in. He does run a practice it's amazing. It's based out of Port Huron, Michigan, and it's called Galera Health and Wellness. So that's where he's based out of. That's where his practice, and we kind of explore what he does there, along with a ton of other questions we pick his brain on. So sit down, and we hope you enjoy it. Dr.
Okay.
Galera, welcome to the podcast.
Thanks.
Yeah.
Glad to be here.
We're excited to have you. I'm excited.
Yeah.
You know
This
that.
is really cool. Yeah,
Excited to be here.
when my dad told me about what it is that you do through Michelle, it really got me interested. My wife's mother-in-law also works with someone similar in your vein. I want to unpack what it is that you do and make sure I got a good understanding. But her name is Renee Cooper, and she works in that health and wellness field, and she's very holistic approach. And I found it very interesting to hear the things that she was doing with her and all the success she was having. And a lot of what she describes sounds similar to some of the conversations we've had about what it is that you do. So yeah, when he told me about this, I was like, oh, we got to have him on. This is going to be interesting. It's going to be fun.
Yeah.
But for those that aren't maybe familiar with your work, can you walk us through a little bit of your background, kind of what you spent the last, what'd you say? I think it was 20 years or so doing in medicine.
Yeah. So my background, past 20, almost 20 years now, I've been in primary care. I've been doing the traditional, conventional medical approach, and where you would see a symptom, and as being trained as a physician, you'd have this medication that you send for it. Another symptom, another medication. And over time, you'd see patients with lists and lists of medications and medications for side effects of medications. And then also, I also see this in the end of life as I work in hospice and also in the nursing home. You have lists and lists of patients, lists of medications that our patients are on. And just looking at my life, I don't want to end up like that. And so I'd had to go through a different path because I don't want to be at that situation where tons and tons of medications towards the end of life here. So yeah, that's how it started.
When you were telling me about that a little bit, you had mentioned that it felt like working in the primary care, people were like, it just felt like a conveyor belt, I think was like the word that you used. What did that actually look like day to day?
Yes. Yeah. So if we're not going to do any lifestyle changes, if we're just going to eat whatever is out there, which we think it's good because it's edible and it looks good on the packaging and tastes good, it looks great, but we're going to end up on this conveyor belt. And if we're not going to do anything to actually be scrutinized what we're putting in our mouth here. So you're going to be on this conveyor belt where the pharmaceutical companies will just step in and just eat whatever you want and get high blood pressure, get diabetes, and we'll give you a medication. We'll give you a prescription for that. And then all the damage goes on down the line here with heart disease, and you have kidney problems, and even ending up with circulation problems and eye problems. So that's where everyone's headed if they're not going to make any changes.
Yeah.
Right?
So it sounds like you were maybe seeing in your experience there, the tradition, and I don't want to put words in your mouth, so let me know, is like, it sounds like the approach was address the symptom, not the root issue, maybe. Is that
Absolutely. Yeah.
Okay.
That's how conventional medicine operates. It's addressing the symptom, knee-jerk, here's the prescription.
Yeah.
It's really not getting down to the actual root cause of the
Mhm.
problem here. So high blood pressure, that's really a symptom of something that's going on here. Maybe you're not being more active, you're not using your body well enough. And so all these things, that high blood sugar, that's really a symptom of something underneath here. And
Mhm.
I really try to get down to the root cause of the problem here rather
Yeah.
than just addressing the symptom. Yeah.
Yeah, that makes so much sense. And when my wife started going to you a while ago, she was kept telling me about, and I came into that one appointment
Yeah.
with her just to see a little bit more about what you were doing. And I knew of you through the community, and I didn't know that you were taking a more holistic approach because I just knew that you worked at, I think it was a physician's healthcare. This was quite a while ago.
Right.
And, she started telling me about it, and I was really intrigued. And then I had to, of course, had to tell Austin. And, it just reminds me of the holistic approach reminds me of, I love how you say conveyor belt because I've got several family members that I think about often, and it reminds me of them. And they have taken more the traditional route, because I'm going to call it that for lack of a better term.
Yes.
And I mentioned this on our prep call. My wife has an uncle who was on a medication, and now he's struggling with severe memory loss. And he ended up getting a new doctor a few years ago, and the doctor, because of the memory loss, and the new doctor said, you should have never been on this medication for 20 years. This is known to have this effect. Now he's dealing with it for the rest of his life. And he's relatively young. He's in his mid 60s. So, maybe he's late 60s, but, he could have a lot of healthy years left. But that medication now has robbed him of at least the last decade of a quality life. So that really woke me up. Um, and then we had two other family members that had a similar situation, a family member who was taking medication, and their doctor gave her another medication because it was making her sick. And then finally, she kept going in and out of the hospital. Multiple doctors looked at her, and finally, she switched pharmacies. And then the pharmacist called her in one day when she went to go get her new script at this new pharmacy. And the lady behind the counter said, "You can't pick this up until the pharmacist wants to talk to you personally." And she said, "Oh, okay. Is everything okay?" And so then the pharmacist came out and said, "You cannot be on these two scripts at the same time." She's been on them for 3 years. She was getting sick off and on. She had lost a ton of weight, and all because she was on two medications that collided with each other. Essentially, she dropped one medication which she didn't need anyways, and she was fine. Everything went back to normal literally the next day. So, and it just and then that was my second wake up call. And I thought, if this is happening in my own family, how
What's
this
the
must
outreach
be,
look like? What's the common
yeah,
yeah, like is
exactly.
that
How
yeah.
widespread is this?
It's widespread because people trust. I mean, before COVID, they were trusting the medical
Yeah,
establishment. I'm not dogging it because medicine is actually
yeah,
good in trauma and in cancer, but when it comes to the chronic diseases and issues like that, it's really there are some other options that can be better. So
yeah.
definitely, yeah.
So, at what point within your practice did it start to bother you seeing this conveyor belt system symptom, not root cause being addressed?
Yeah, even just in primary care, I'd be looking at why patients are tired, and then typically in your conventional medicine, you do these regular blood panels. But I take it a step further. It's just vitamin deficiency. There's a vitamin D deficiency, B12 deficiency, and absolutely they're low. And so once they started correcting those, and insurance won't pay for that, but the patient's willing to pay for that over the counter, correct those numbers, and there's great improvement.
Mhm.
So um, at that point, when I started to do that, there's actually my life started being affected here because all that stress of seeing so many patients every day, and um, as with a background in medicine, I was having this aching abdominal pains, and at some point, where with following the conventional medicine, you'd treat yourself maybe with like a proton pump inhibitor like Prilosec or Pepsid, and at some point it just got worse and worse. This abdominal pain that I had, so I ended up in the hospital, and all that workup came back negative. And there's only fatty liver and prediabetes, and so just seeing that just this prescription medication approach is not working, I had to look at alternative ways to
Mm,
actually address my issue
okay.
here. So, and that's how in my life, I'd had to do some lifestyle changes, and with the lifestyle changes, that's I've actually reversed that prediabetes and all these abdominal issues that have been resolved. So,
So it kind of
yeah,
started with you a little bit, it sounds
yeah,
like, right? So you
actually,
were kind of the catalyst to shift your mindset, which is like you had these issues. It almost sounds like you were sort of living out the same patterns that your patients were, of like treating the symptoms, taking this when this happens. If you have side effects, take this other thing. And then you were realizing, okay, this isn't working. I got to figure out the root issue. And then you're like, oh, wait, once I start addressing root issues, these other things, prescriptions, traditional routes, aren't really necessary. I'm sure not in all cases, but in some cases. And is that when the shift happened? You're like, okay, I need to start looking at my patients a little bit differently within my practice or wherever you were at.
Yeah, there were like patients that were morbidly obese or even obese and they lost the weight and then their diabetes resolved. And then that was like the insights. It's like, okay, so there's some link there with the obesity and
Hmm.
diabetes. And so definitely that was also part of the shift here.
Hmm.
And that those changes in patients and also changes in my life here also. So
Yeah,
yeah.
that's super interesting because I'm imagining there was a point where maybe, I mean, if I was on this path, I mean, you're educated to go down this certain route that seems to be best suited for all intents and purposes, well intended. Treat patients with these things, X, Y, and Z. Again, I'm just assuming I've got no background at all in this, so
Sure.
please
Sure.
correct me if any of this is completely just ludicrous. But I have to imagine there was that point where you're like, okay, what I'm doing, I don't really fully believe in anymore. I have to kind of like make this shift. Was that hard to do despite knowing that the changes were evident and like seemed maybe obvious? Was it still difficult to be like, okay, I have to kind of go against the grain a little bit?
No, not really. You see all these this dogma and the way that you're trained, and you ask questions about it, and then it's just don't ask questions, just do it that way. And it really shouldn't be a don't ask question type thing. It really should be give me an answer or I'm curious about it. Is there should be an answer for it? And then that led me to more if I can't ask questions, then why I can't why is it a dogma? Do you actually follow that direction? So
Mm,
I've just been pretty much open to other options. And I mean, this is the way that you go through training and to get through to the next level. But I've just been pretty much open
yeah.
and stayed that way.
And I would actually wonder too, because I've had some experiences with other primary care doctors where it seems like, and I'm wired the opposite. It seems like they're very problem solution oriented. I mean, it's obvious that's their role at the core of it, right? You kind of mentioned that a little bit
Yeah.
earlier. Like, patient comes in, diagnose the problem. What's the issue? Here's the solution. On to the next patient. Do you think that's a result? That process is a result more of the workflow demands of a lot of these doctors, where they don't have the time maybe to invest a little bit more into some of those underlying causes because it's a go 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 system within their practice or within their day to day? Or do you think it's more so a wiring of the individuals that typically lean towards medicine? They're more analytical, but in the sense of, problem solution. I've kind of worked out the kinks. I've had the study, the schooling. I know how to solve problems at a quick rate. So this kind of flows with my kind of working competency.
Yeah. I think it's a combination of both because the way that the physicians are taught, here's the knee jerk prescription for that. And plus, providers are really stressed and you only get paid much for that visit. And the typical provider visit's about 7 to 10 minutes. And within
Hmm.
that time, you got to make some decisions, get the next patient out here. So you can keep that system going in order you just make overhead or even just make it through the day. So it's a combination, and even patients are even trained into that direction where,
Yeah.
"Oh, okay, this is a quick fix. Here's a pill.
Yes.
That's all I need."
Yeah.
And then eventually it doesn't work for them, but they're out the door and trying it out and then come back again. So
Yeah.
yeah, it's a combination.
Yeah. I've made note of that too, just in my own personal experience. Again, going to physicians just for checkups. If I ever had a question, the environment of all these different doctors I've seen over the years, the vast majority of them, the environment was like, it was created to, whether intentionally or not, to not question or not really bring something that's going to prolong the visit almost. And maybe this is, again, just my own experience. And I'm
I've had
curious,
the same experience.
where it just feels like the conversation is very structured around, again, I keep repeating it, problem solution. But as a patient experiencing that, if I had a question, the pressure around that conversation going fast and quick made me feel reserved and kind of held me off from maybe questioning the solution that they suggested. Or if maybe I had a question about it, I wasn't quite sure if I want to, explore that route. Like, I felt like a little bit closed off because the conversation was so rushed and so structured. And so, was that something that you experienced when, either as a patient yourself or again as a doctor?
Yeah, yeah, both as a patient and a doctor. Sometimes you don't know, and you're not willing to admit that you don't know, but I'm the doctor, and I'm gonna act like the doctor, like I know everything, I'm the expert. And I really think that at some point, um, providers should be open and have an open mind because even like during COVID time, it wasn't like no one stepped up to actually make some change here. Everyone left up to the government to make a decision on what this next steps were. There weren't any. Harvard didn't do anything. John Hopkins didn't step in. Anyone didn't step in actually to make some changes to actually help people. Everyone was funneled towards the vaccine,
Mm.
and this is what's happening in an industry. So everybody's trained that way, and so I think that providers should have an open mind to actually okay, I don't know that answer. I can get back to you with that question,
Hmm.
but providers are limited with time also.
Yeah, yeah.
So yeah, it's a balance. It's a conveyor belt, but definitely should be. It's a concern that should be addressed.
Yeah,
Yeah.
I've noticed that same thing, Lawson, how you described your experiences at doctors. I did have one doctor for years that was the opposite of that. Um, I think I can say his name. Dr. Ira Sabah was my doctor for
Mm.
years. He was amazing, but he's retired. He would take the time to probe and listen and probe and listen. Okay, why are you having that? Okay, tell me about this. Tell me about that. Before that, I didn't have that experience with my previous doctor. And then after that, I've not had that experience.
Hmm.
But and I think it's normal, like what you said to your point, Austin, about when you go in there, you first of all, you're kind of like a deer in headlights because
Yes.
when you go in, sometimes in the medical field, doctors and nurses are using words you have no idea what it means.
Yeah, sure. Yeah, yeah,
I'm
yeah.
like, I
Oh,
have no
yeah.
idea what you just said. But so not only are you kind of on your heels as a patient, you're trying to process it at the same time. Like, okay, what did they just say? What am I supposed to take? What
Yeah.
does this really mean? And then they're gone. They're like out and
Yep.
they're in and out. And then there's no dialogue, it seems like. So that's the thing I've struggled with. And again, it goes back to what I mentioned earlier. If we struggle with this, it's I mean, it's gotta be widespread,
Yeah.
because it seems to be the system. But um, yeah, I mean, what so my question to you on that is, what can a patient do? If someone's listening right now or watching this podcast, what can they do if they're, in your opinion, as a medical professional, like how can they either slow their doctor down or say, hey, I don't know what you're telling me right now, Can you give us some tips?
Yeah, yeah. You should speak up. I mean, even beforehand, if you have some questions, you can probably submit them early so that maybe the provider doctor can actually look ahead and have a heads up to actually the concerns. And You really should be an advocate for yourself. If you, I mean, and then in the end, if you're not really happy with your provider, I mean, there's other second opinions that definitely should
Yeah.
look into. So
Yeah.
yeah,
It's funny you suggest that and you talk about it. It echoed what I said because the if I'm trying to flip my experience into a somewhat of a positive that I've kind of gained from it is that it's trained me and I'm still learning it. It's trained me to be more honest. A lot of times in these situations, like you're saying, you're deer in the headlights, things are moving fast, words are being said you're not really sure of. And so it's trained me in those moments because I have experienced moving through things where I've had questions and too afraid to ask for clarity or to question maybe a solution. And I always left those conversations just feeling like, okay, I want this to stop. Something has to change.
Right.
And so I've had to learn how to be more open and honest in those conversations. And I just had a experience somewhat recently, actually, where I did that as like a sort of a first step. And it was amazing to see the doctor's reaction because they opened up in a way that I've never seen them open up. And it almost made me consider after I left that conversation, me just asking a few questions and also showing interest in their field because I also have interest in this. So I'll do some very minor, read some research, things that I'm interested in on topics. So I use that as an opportunity to one, connect with them to maybe open them up a little bit on something I had been researching. I just want their general thoughts on, but then also to explore something related to the reason I was there as a follow up to it. So I think doing the first one got them on the page of, oh, this person actually is considerate of, the field or industry that I'm in. So it makes it more relatable. I think it
Mhm.
makes them feel more comfortable possibly. And then the follow-up question, which was the more honesty, the questions I would have, walked away with traditionally, be like, I should have asked that, or I wish I would have asked that. I asked, and his response was so much more engaging and open that I was like, oh, this is a side to this doctor I'd never seen. And so part of me wonders that if patients did that more often, one, I think they might see just this is one experience. So I'm trying to stretch this across,
Sure.
Western medicine, which might be a bit of a
Yeah.
stretch, but it might open up the doctor from getting off the hamster wheel of like the day's fast. I've got 7 to 8 minutes, traditionally speaking, to get through this, to get on to the next patient. So sometimes I feel like maybe that alone would help them to slow down and be like, oh, okay, wait, yes, you're actually interested in these things. You don't just want that fix.
Right.
Okay, let me actually explore this. Would you say that that alone could be a factor that might influence to some degree some of these individual patient experiences?
Oh, definitely. Because I mean, usually the typical patient just, I want a prescription. Runs my prescription when I get a, and that's all they're looking for. So they can walk out the door with a prescription. But then if you have patients like as yourself, as you're having that interaction with your provider, that you're actually interested in, and why is this happening? Having that curiosity and expressing that, and not just there for a prescription. And so definitely,
Yeah,
I'm sure providers will step back and actually take a look and
yeah.
think about it and answer your questions. So yeah.
Yeah, it was a good question that you posed, but it triggered that thought in me, Dad. But okay,
Yeah.
so shifting the focus, and I actually do want to come back to the question I posed him because I want to pose it to you as well. Um, so I'm going to put a little pin in that, and maybe if I forget, one of you can remember me
All right, I'll try to
Sure.
remember.
because I'm sure I'll forget. But so when you decided to shift away from that model, what were you trying to build instead? Like, what was the non-negotiables for you as you started to
Ooh,
approach?
good question.
Right. Right. So you really had to be a firm in actually getting clients to actually really commit to actually making lifestyle changes, actually going through, because we go through 5 pillars of health here. And the 5 pillars of health that we have is, of course, is detox, the nutrition, the exercise, hormones, and of course, the mentoring. And using all those 5 pillars all at once, they really have to commit to all of those. And it's something that can help their body develop a system so that they can take those what they've learned through educational curriculum and use that for the rest of their life here. And so it's really a commitment to actually make those lifestyle changes, to actually find out the foods which are the right for them, find out getting their body detox. Even your body's already detoxing, but take your body to the next level of detoxing and getting your body to move forward, exercising, addressing hormones, of course. And of course, you need some guidance with a mentorship. So it's really a commitment to that lifestyle change,
Hmm.
not just going back to the standard American diet and a little cheat thing here, a little cheat thing there, but actually realizing all these sometimes small cheats actually, it's a downward spiral. It gets you off that track here, where you
Hmm.
actually
Yeah.
getting to your goals. So yeah,
Now that approach, as a refresher, so at Galera Health and Wellness, there's the 5 pillars: detox, nutrition, exercise, hormones, and coaching,
yeah, coaching your mentorship. Yep,
mentorship. Okay,
yeah.
okay, right. Now, within those 5 pillars, one, presenting that as a to patients that may be interested in your practice, do you find that they're coming to you already sort of bought in and tired of the traditional route, or do you see them coming kind of maybe curious, but the approach as a result of them realizing, oh, this is a bigger commitment. I actually have to put in a lot more effort. Do you see them like maybe shying away, or what's the response look like initially when you talk to them?
Yeah, it varies. I mean, I like to say I can help everyone, but really the answer is no, because unless someone's actually committed to actually put in the work there, some people may just maybe tried some diet changes and it didn't work for them. Some people just doing all the exercise but eating a crappy diet, and of course you can't out exercise a bad diet here. So, and then of course detoxing. Our body's already detoxing with getting rid of waste. I mean, it's kind of like a through the urine, stool, and sweating. But we take it a step further here through supplementations and getting the right foods, getting your body detoxing. So, um,
Can I actually
yeah,
can I
yeah,
pause you real
yeah,
quick and ask
absolutely.
about that? Because the detox pillar is something I'm interested in.
Yeah,
Because the nutrition, exercise, hormones I'm interested in as well, because I know very little.
yeah.
Um, but the detox one I'm also just inexperienced with. So can you elaborate what you mean in a practical sense of what that pillar means and
Yeah, sure.
for patients and what it looks like?
So, I mean, similar to like taking out the trash. Every week we take out the trash. So, similarly, going to the bathroom, getting rid of urine, stool, we're sweating. Um, the body's getting rid of toxins through the bile and so forth. But we actually take it a step further here. And through a detox process, we do more like a spring cleaning. And so that's where we actually use that through supplementation and take that step further, getting the body rid of toxins. So
And what's the approach? Is it individualized, like you kind of mentioned? Depends on what the individual needs, and how do you assess what they need?
yeah, we have different protocols depending on what they come in with, and so it's really customized to their
Mm.
situation, their case. So yeah,
I'm so fascinated. So I want
I
to slow
know.
down for a second because
Sure.
did you have a question? Do you wanted to jump in
No,
here?
keep
Sorry.
going. I have some questions, but they're not in this vein. So
Okay.
I'm gonna wait.
Okay.
So,
Which phase, like, is the detox phase? Do you find that the most challenging for patients to kind of work through, or?
it can be. I mean, when you're doing like a pre-detox, sometimes you're cutting out all the sugars, sometimes you're cutting out caffeine, and so that can be a rough period when your body's just getting used to not dependent on all those
Yeah.
things like sugar and caffeine
Are those
and
the two most common you find having to be a component that needs to be removed during this for most patients?
yes, I mean, it doesn't
Okay.
mean you're forever going to have no sugar or no caffeine, but definitely when you bring that back, if there's some symptoms that happens, then that could be a problem. So,
Why
yeah.
sugar and caffeine? I mean, sugar is probably the obvious one,
Yeah.
but caffeine I maybe not would have thought would be in that equation. What's the element of caffeine's influence in
Yeah,
this?
caffeine, if you're dependent on caffeine, that's actually telling your body, okay, I'm not tired. I'm not tired. And so you need that every day. And so once you back off on that, you let your body naturally figure out, okay, this is myself to trying to wake up naturally. And I don't need caffeine to actually push me to actually not feel tired. So,
Mhm.
yeah.
I've done that would probably might be the hardest for me
caffeine.
to take on out of anything within this
Yeah.
detox, if I'd imagine.
I would feel like most people would be sugar. I feel like
Yes.
that's
Yeah.
got to be your biggest pushback because I
Yeah,
mean it's in
actually,
everything.
yeah,
Yeah.
It's literally in everything. I mean, since Michelle's been on my wife has been on your program, she's like, "Oh, that has sugar in it." I'm like, "No, it doesn't." She's like, "Yeah, it does. Look at the label." And I'm like, "Oh my gosh,
yeah.
it does."
It
Like
does.
they put sugar in everything. So
Obviously, you're
it's
talking
in,
about added sugar, so
Right.
fruits and
Right.
things of that
Right.
nature. Okay, yeah,
Right.
yeah, I was talking about like
yeah.
things boxed goods or whatever it might
Yeah.
be, canned goods or whatever. But
There's two things I would note on the sugar and caffeine. I did my wife and I also tried to do no sugar for a month. This was years ago, and I had the same reaction that you had or that Shell had as
yeah,
you're kind of looking at things and she's trying to remove sugar from her diet. When I was going through it, I was like picking up items that I would have never thought had sugar added to it, but of course it's got sugar added to it,
yeah,
and just that simple awareness was such an important factor.
yeah,
Uh, Whether I followed through with it completely or whether it totally made a lifestyle change, it planted a seed that now I'm more conscious of these little elements within my nutrition and diet, whether it's sugar or when years ago, I've been doing it for quite a while now, but counting calories, macronutrients, even micronutrients to a degree, whether it's fiber or fill in the blank, those little habits started to stack over time as I started to become just more mindful of what I'm consuming and what's in the food I'm consuming. And that alone, I think, compounds and for me personally has created a much bigger
mhm,
impact over time on my approach and understanding of nutrition as a fuel source, which is crazy to me that I we kind of and I feel like this is similar from a lot of people, and especially talking about your practice, the traditional practice is the approach is like there's not a lot of education for me there was around food and its impact and our understanding of it and how it's a fuel source and understanding the basic macronutrients, how they interact with your body and energy levels, etc. So growing up I never really was mindful of it. I just ate what was fun, what tasted good, like you mentioned. And there's one specific story. I remember growing up, I was young and I had gotten like a candy bar and a bag of chips, and I was with Uncle Steve, and we were in a car. And I came back to the car, and I remember he said, "Well, I wish I could eat like that." And as a kid, I was super young. I was like, "You can't eat like this? Like what?
what are you talking about?
What do you mean you can't eat like this?"
Right.
Like I was so confused.
Right.
Yeah,
But again, a part of me wonders that foundational element of just basic nutritional information being taught at an early age has got to be such a massive impact as to why we see this approach in Western medicine and how patients respond to just here's the solution, go with it.
Yeah, you wonder all about that. If there's something not necessarily nefarious, but just funneling towards the sugar, because there's an industry out there that's more promoting the sugar option rather than more protein and fats. But it's interesting how you showed that with the habits. And I mean, it takes almost 3 weeks to form a habit. So
Mhm.
building on that is building a better lifestyle here. So yeah.
Yeah, I one thing I noticed about your program is the fifth pillar, which is coaching, because I feel like that's something almost to the point that you just brought up, Austin. That's not talked about because you talk about, maybe, the nutrition, you hear about fitness occasionally. And of course, if you jump on Google, you're going to get every opinion in the world. So, yeah, but no one, even when you do the search on Google and whatnot, no one really talks about coaching. And myself in the past, I've had coaches when I was training and racing. I used to do a lot of endurance mountain bike racing for quite a few years. And when I went from trying to do it myself to when I got real serious about it, I had a coach for a few years. My my level went from here to here. My commitment level went higher. My performance output was way higher. It was just a whole different level of being an athlete. And we no one talks about that. So
Mhm.
can I ask you, like, when it comes to coaching, can you give us just an idea of what you do? Maybe share that with the listeners in your coaching.
Yeah, absolutely. So after the initial assessment, and I taken assessment of the client's situation, then I incorporate what we really need to do to get the client to their health goals, and that's where the coaching involves. It could be every 2 weeks follow up because you get an assignment for the week for what's the action plan for that week, and then through those follow up coaching calls, then we discuss how the week's progressing, how these action changes are going on, have any questions, and through that we can guide the client towards their goal, and be there actually for them, support them, and actually celebrate all the wins. And
Yeah,
so definitely that's
that's great.
Yeah,
And
important.
that's got to
it's
play a big role because, I mean, most people, I feel like that have had an experience using a coach versus not using a coach, whether it's in fitness, whether it's in
yeah,
any space. The feedback I've ever heard is how big of a difference it makes in their accountability factor alone.
yeah,
Definitely.
And
absolutely.
I mean, having an external source to sort of rely on and work with, uh, it's a big driver. It keeps them on the path. And in your experience, is it is that fairly common? I would imagine again that most people find the coaching and the follow ups and that accountability a massive part of what keeps them on that path, or is it more like, well, this is all working? Maybe your client base is more independent and they're like, okay, I've got a lot of these steps. I don't need as much coaching or hands on.
Yeah, it depends on the client. Some clients need that accountability and keep them on track, making sure that habits are being formed there. And then there's clients that are just, okay, I can do this on my own, kind of, and I just need some little guidance here and there. So really adjust it to the approach to the client. So everyone's
Yeah.
different. Yeah,
Yeah, that makes sense.
Yeah.
Yeah.
And getting back to the nutrition part of
sure.
things, what do you think is like the biggest misconceptions that people have around diet and
Oh, that's another
nutrition?
good
It's
question.
pretty broad speaking, but in your experience, again,
Yeah,
this is just speaking from what you've gone through.
I think uh, I think the big thing is like organic is more expensive, and I'm not willing to actually pay for more expensive produce. And really, the when you eat organic, then you're getting away from the glyphosate. You're getting away from the Roundup that's been sprayed on produce, and even now sprayed on wheat as to help it dry faster. And so, when you're getting away from that, then you're not going to expose your body to all this glyphosate, and because there's already issues that's going on. People are trying to have immunity for these big companies from um, the responsibilities of what these pesticides can actually do.
Mm.
So yeah, that's a big one. I mean, that's what comes to mind.
When you go down those paths of kind of unfolding the nutrition side of
Right.
the pillar with your patients, the detox, removing things and all that, how do you feel? How do you balance providing the information that is helpful and necessary for them to know without overwhelming them or making them feel like, oh my gosh, I can't have this now because it's got that, or wait, no, I can't go out for that. I can't do these social events. I got to remove myself from that. Like, what does that balance look like?
Yeah. So it's really a slow plan for that. So, and you really like spoon feeding. And it's actually so you really have a plan of action for the week and nothing else. So that's actually what you're doing here. So I mean, like for instance, for when you're starting on the program, you're cutting out processed foods. You're not worried about anything else there, just processed foods. And so that's kind of like the start here. And then next thing for the next week, then a few changes then after that. So it's really spoon feeding.
Hmm.
So you're not overwhelmed. And of course, if there's any questions, always there to be around there to support. So yeah.
For me, when I've had a long battle with nutrition, fluctuating weight up and down, binge eating at times, not, cutting calories really sharp. So I've had I've had to manage my relationship with nutrition. Although I don't want to put that much, I don't want to put that much weight into nutrition as if it's a relationship, because I think part of that mindset alone has caused what this imbalance has had for me personally. But with me, I'm typically an all or nothing individual.
Yeah.
And if I like something, and this is a symptom of ADHD. I know, Dad, you can probably relate to a lot of
Oh
this
yeah.
too.
Yep.
We're very similar in this way, a lot of ways. But the way that my brain functions, it's if I like something and want to do something, I'm all in, and if I don't do it all in, I don't want to do it at all. And it's great for a lot of ways, because when I do go all in, I'm super productive. I'm super motivated. I'm not even motivated. I'm super disciplined, and I'm on the path. But that balance is hard for me to, you can't always be all in, I guess, is something that I've tried to learn and sort of rewire my brain to be. Whereas if I'm all in and it's all or nothing, as soon as I take one little step off in the case of, like, let's say nutrition or diet, right? Again, my ups and downs have been common. I'm on a diet. I'm trying to reduce my weight to a certain, goal range. And one day I go 200 calories over my daily, limit. And that creates a downward effect, spiraling effect in my head. And I'm like, okay, 200 calories, I might as well just throw out this week. You know what? I had that cookie. I'm just going to have another cookie. And it creates this domino effect, because
Right.
again, it's all or
Right.
nothing. So do you find that common with your patients, or do you find like there are tips and tricks you give them to help balance and spoon feed them along this process so they don't fall into that trap?
Yeah, definitely. I mean, I think that you have to give yourself some grace. You can't always be perfect. You're going to make mistakes. We're human beings and we make mistakes. So it's something to learn from. And there's something that kind of triggered that. Why that cookie? Was it just there, or you're just kind of stressed? Was there's something happening around this situation which um which um which limited your ability to refuse that cookie, or it could have
Yeah.
been something different. Could you done a substitute? And you see the cookie there. Could you eat like some veggies in place of that cookies, or some nuts in place of that cookie? Because like, and that's where it's where I mean that's where the curriculum kind of helps you
Yeah,
try to guide you like away from the sweet stuff, which is it's really bad for you, but it's so
sure.
good. But yeah,
Sure. Yeah,
yeah,
yeah, yeah. It's a love. It's a balance.
yeah,
Yeah.
Something that I've done somewhat recently. I've been experimenting with when these cravings come out,
sure,
or whether it's sweets or fill in the blank for the whatever it is that you have, is that the mindfulness element. And mindfulness is thrown around so much, so I'm always. It feels like a statement that I don't know what people interpret it as nowadays, but what I started to be more mindful of is when I have those cravings, I'll stop and think, what's the feeling driving that craving? And I'll just sit with that feeling for a minute.
Well, you
Rather
think
than
deeper than
just
I do.
rather than just, I see like, I love dates.
yeah.
My
Yeah.
sweetness of choice is just a date with a little bit of peanut butter and salt on it.
Oh,
And
that
it's
is
Good.
good.
I
Yeah.
could devour a full box of those. And I have dates sitting out on our counter commonly. And so all the time I'll be just walking through the kitchen, and usually I'll just see the date and I'm like, date sounds good right now. I'm gonna have a date. But lately I've been just stopping to think, okay, what's the feeling driving me to have this date? I know that sounds weird, but I'll stop and just
Yes.
sit
Right.
in that thought,
Yeah.
because I find that I'll just react to things throughout the day because of systems and habits that have been put in place through my daily routine,
Right.
that I won't actually stop beforehand and assess why I'm making certain decisions. And they've usually been developed, in my experience, because they've benefited me in some way.
Yeah.
Whether it's I'm desiring this flavor right now, I get it, I get the reward factor.
Right.
That creates a kind of a loop system in my brain to, okay, I see the date, tastes good, I get the date, I
Yeah.
get the reward, I move on.
Mhm.
But I've been finding that the more that I stop and pause, especially around habits or things that I'm desiring in the moment, that I can sort of, not always, and I'm just starting this, so it's hard, but I can kind of stop myself from making that decision, not just because I'm creating space between the thought and the action, but because I'm trying to analyze, why do I have this thought to begin with? And when I
Right.
sit with it long enough, I can usually unpack it, and it's usually just boredom, or
Right.
it's, you know, it's a visual sensation. I see the thing and I want it, but I'm not actually hungry, right? So I don't know if that's something that you resonates with you at all, or even you, Dad.
No, absolutely. Every time you get a sugar hit, that dopamine hit, and you
Yeah,
get that rush. And
Yeah.
so that's part of it. So that's actually good that you're actually slowing down and actually just processing it rather than just not thinking
yeah,
and really bring it to the front and being aware of that. So, and that's actually a treatment, a therapy to actually break that cycle.
yeah,
So
yeah.
Yeah. I mean, oh, you're good.
No,
I have
no,
another
please.
mindful question too.
I'm rolling.
Mindfulness.
yeah,
You go. You go.
So on mindfulness, I think about, because as you guys are kind of going back and forth talking about that, I've worked in the housing industry for years, and I notice people will they'll invest money in their house, they'll invest money in their 401ks. Investing is not a new concept to people, but where's the disconnect? Because we don't. That's my question to you, because we don't seem to think ever about investing in ourselves or investing in our health or investing in our future in that sense. What good is the nicest house and the most money in your 401k if you're not going to be healthy later in life, especially like you alluded to earlier? So how do you bridge that gap for people, or what can you recommend to listeners?
right. I mean, it has to come to some point where they're ready to actually make that change. Maybe they're tired. Maybe they're so sick of being in pain, the joint pain, they can't get out of bed. It just has to get to some point where they're sick of maybe all these medications and it's not working for them. And until they get to that point, until they actually see that, being aware, I mean, maybe it's a heart attack. Maybe they end up in actually laying in the hospital bed and saying, what could I have done differently?
Yeah.
And that's where I'm trying to get before people get to that actual point, actually see that there's these changes that are happening. So before there's actually a healthcare crisis in their life.
Yeah.
And so, um, yeah, I mean, I think that there's in the industry that they're trying to program people that is the direction to go to. The
Mhm.
401k is a nice house, but don't worry about your health. The medical community will actually be there for you with injections and pills and
Yeah.
so
The quick
forth.
fix.
Right, the
Yeah.
quick
Yeah.
fix.
The quick fix. Yeah.
Right.
Yeah.
But I think as the younger generations comes up and there's more information out there, actually more curious people that are out there and actually is questioning that actual line of thinking that the medical industry is actually moving people towards. And so,
Yeah. Man, interesting. Austin and I talk about it off and on, and you just mentioned the younger generation. Can I
yeah,
ask my Gen Z
Yeah,
question?
yeah,
Austin?
yeah.
Is
Go
that
for
going
it.
to throw you
we-
off?
No, no, no. Go for
Okay.
it, please.
So I have a question about Gen Z, which is, and I had to look up Gen Z because I wasn't sure before this podcast, for like someone in their mid-20s, and I've noticed that my stepdaughter's 25, and her friends and conversation and kind of culture around that age group, which I think is 14 to 29-year-olds roughly. I googled this earlier. I should have remembered the exact
Coming
years,
prepared.
but I've noticed that there's a lot of anxiety medication in that generation. There's a lot of there's just, I guess that's probably the best way to say it. So, I don't know if you could break that down. Is in your opinion, is some of that culture? Is it diet? Is it a combination of things? Like, why are so many kids and young adults on anxiety medications? I guess that's my question.
yeah. I mean, part of it is because the medical community just wants to give a pill out, a quick fix, and really not get down to actually the root cause. I mean, is it something with the family situation? Is it something that the you can actually talk through with the patient actually to work through that? Is it some? But that's a quick fix, and then once you get on the quick fix, and those anxiety medications, they're addictive. They're really
Yeah.
and get higher and higher on the dosage, and you have these kids that are on high dosage that really should hospice patients are actually taking. So it's that's part of the problem. Other problem, it's just not willing to actually take the time to actually get down to what's causing the anxiety, because there is really even a gut health relations
Hmm.
to the anxiety and depression and 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 so forth. So there is that link also. Yeah.
Yeah. I mean, how many of these patients, they just feel like, do you see it, where they just feel like, I can't get off this now because I can't function without this medication. So even whether they need it or not, it becomes more of a mental barrier for them. Is that a real thing? I feel like I've noticed that, but
Definitely. It's a real thing. They're dependent on these medications and trying to get them off of it. You have to really have to slowly wean them off of it and have them have the right mindset there to actually get them off of it. So,
Yeah,
um, yeah,
it just worries me for that generation because if you start on these medications that young in life, and then now, of course, you're in the mindset of like we've been talking about, I just need a pill. I'll just need another pill for the next thing. And then it's just literally a snowball effect. And where does it stop? I mean,
yeah, that's part of the crisis that we
Yeah.
are in today. So,
yeah.
Well, speaking of that too, you know, being young on medication, uh, one thing that I wanted to get into, and I don't know how much experience you have with ADHD or opinions, thoughts, how much research you've done on it, but it's something that I've dealt with for a while, and I know it's widely misdiagnosed, and that term gets thrown around so much. If someone has a short attention span, they automatically think they've got ADHD. So, but with it, I've done a handful of research and here and there, and one of the things that I found really interesting that I wanted to get your side on, if you have any familiarity with this, is obviously the medications that are commonly prescribed for ADHD are things like modafinil or Adderall, Ritalin,
yes.
anything fill in the blank. And for individuals at a young age, and I think the age was between somewhere of like 6 to 9 or somewhere 6 to 8, if they are expressing symptoms of ADHD and it's also expressed throughout their parents, right? It being a factor of getting kind of passed down, so to speak, is fairly common from my understanding. The neuroplasticity of kids' brains at those ages, getting them on a medication early, I've heard of theories, I don't know if this has actually been proven, of that actually creating different pathways that allow the effects of something like Adderall, for example, at a young age to have long term effects that they can actually be prescribed off of as they get a little bit older. Have you heard of this at all? Does this sound like nonsense to you from your experience?
I mean, definitely the brain is still developing. So you have that one, and you add a medication to that. So it's I haven't heard any long term studies on that, but it's definitely an issue that there's not any long term results. So that's kind of the extent of my knowledge of that
Okay.
area. Yeah,
Okay.
yeah,
I was always curious about that. I don't know. I had heard that there was some kind of studies that have been done on it, and I don't think any of it was sort of conclusive or overwhelming, of
right.
course. But it really fascinated me because I've got a brain that I love the way it's wired a lot of the times, but just like everyone, there's pros and cons, and the cons always worry me. Now that I've got two girls at home, I've got a 3-year old and a 10-month old, so I'm like, I'm projecting constantly. Anytime I see my 3-year old do something that aligns with how my brain works in a way that, you would label ADHD or whatever it is, I'm,
Yeah.
I'm, I'm sort of like internally like, oh no, is she going to have to deal with these hardships because her brain's wired this way? And especially if really a lot of it comes down to, the traditional school system, which is certainly not wired for, it's very cookie cutter. It's not
Yes.
wired for an ADHD brain at all, or much less any other, non-neurotypical brains. But so I'm always just kind of projecting and worrying. So when I hear some of this research, I'm like over obsessing and analyzing, But then at the same time, it's I think for me personally, I don't know if anyone else can relate to this, is viewing ADHD. What changed a lot for me was viewing it more as a feature, not a bug,
Right.
and
Right.
sort of shifting my mindset on it. Because I think if you don't view it as that, like in my experience, previously it was always a barrier to things. And when I removed the barrier and stopped treating it as a barrier and started working with it, it's been so much better for me. Uh, and I'm wondering if some of these patients that you have, it's probably similar in terms of them looking at all of these steps and these barriers to getting healthier. Once they stop viewing them as barriers, right? You have to do this, remove these things. Maybe you need to start being more conscious. And it's a spoon feeding slow process.
Right.
That they start to see them as, uh, a cooperating element rather than a resistance element. And over time, I'd imagine that builds a relationship towards nutrition, exercise, movement that becomes a natural part of their identity rather than at the beginning, this thing that they're fighting and resisting because they've been conditioned for this quick fix.
Right. Right.
So that's just kind of my personal experience. I don't know what
Yeah.
you've had with that, Dad. I've never really asked you about that.
Well, I mean, yeah, I mean, pretty much what I would echo what you said. I mean,
Yeah.
with ADHD, I had ADHD I almost feel like I grew out of it.
Yeah.
Is that normal for people to grow out of it? Because when I
You
was
can.
younger, wouldn't say I was a severe case, but I was above medium. you know,
Yeah.
and
Definitely functional. Yeah.
yeah, and my doctor at one point said, "Well, do you want to try this?" And I don't even remember what it was. This was years ago, and I was a young adult at the time. He's like, "Do you want to try like a small dose of this or that?" And I tried one or two medications over the course of a couple of years, and I don't think I took it consistently, but I just remember one day I went back to my doctor, and he's like, you can beat." He was very candid with me. He said,
Mhm.
you can beat most of this through exercise." Because at the time I was overweight. I couldn't I couldn't go up a flight of stairs. I probably was at least 30 pounds heavier than I am now. And I couldn't go up a flight of stairs without being winded. And he could clearly see where the problem was. He's like, he knew my diet, and he just said, you can beat it that way. And I thought to myself, why am I not going back to what I said earlier, taking my health serious? And so that one little thing that he said began a snowball effect in my mind. I didn't change my habits right away, but then I had an answer, another solution. So I just quit taking the medication, and I didn't get super fit right away, but I just started moving my body a lot more, going on walks, doing little bike rides. And within weeks, I had zero issues. It was like I was just so much more alert. My clarity
Mhm.
everything was back to how it should have been.
Yeah. Yeah.
And it was just a little bit of consistent exercise, not
Mhm.
even a lot, 30 minutes a day, 2, 3 days a week. That's all it was. Get my heart rate up a little bit.
Yeah.
So,
That little change creates that compound effect that has a
Absolutely.
ripple
Yeah.
yeah.
in other areas.
Yeah.
One thing I'm also interested that you mentioned when we spoke last was your study you've done on insulin resistance, and I don't really know much of
Oh,
anything in that area.
yeah.
And you talk about the role that it plays. You tell me about let's say for someone that knows nothing about it, what is insulin and what is its role in overall health?
Yes, so definitely insulin is a hormone. It's produced in the pancreas. So the hormones are the communication between cells, what to do. And so insulin is produced when you have sugar gets absorbed, and it tells the body, okay, we need to start processing this sugar here. And so if this insulin is being produced as we take in more and more sugar, it's kind of like your kids telling you, mom, 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 or dad, dad, dad. At some
Mm,
point, you're just going to ignore them because they're just on nonstop.
yeah.
And so as these cells are getting the signal from the insulin, at some point they're just going to shut off because maybe they're just too full with filled up with fat, or they're just not going to take that signal. And so, and that's what we characterize as insulin resistance. And that's where we had the issues with the blood sugars going up here, and then that proceeds next to diabetes and so forth. And so that's why I've actually done the continuous glucose monitors, and I've done that
Mm-hmm.
myself and seen which foods actually cause that blood glucose spikes. And
So you've used like
yeah,
the patches that
yeah,
you put on and the monitor.
absolutely.
I've seen those before. Did you
Yeah,
have good success with the accuracy of
yeah,
it and
the accuracy
experimenting?
you can test that, get that calibrated with the blood sugar readings, and actually you can see what the kind of food reactions you have
Hmm.
with that.
Can you actually describe that for maybe some of the listeners that aren't familiar with this
Yeah,
glucose
so a
monitoring system?
continuous glucose monitor is a monitor that is applied to the arm, and it injects a probe there, and it'll read your blood glucose continuously throughout the 24 hours. And when you have food that you take in, you can have the blood glucose go up or down, and monitor that, and
And you can track this, right?
you can
From
track
my
it.
understanding.
Absolutely,
Yeah,
yeah,
just
and
like
live.
it's like
Can
an
you see
app
it on like
or
a phone app?
yeah,
Yeah,
That's what I was
absolutely,
wondering.
yeah.
phone app. Yeah,
So you can actually like
Really cool from what I've
have this
seen.
on your arm, take a
yes,
bite out of a candy bar,
right, and see
and
that
then watch it on your phone.
absolutely, yeah,
Yep.
Oh,
Yeah.
that's crazy.
yeah,
I'll see. There's some nutrition people in the nutrition fitness space will test this too, and obviously each individual is going to react to food
right,
somewhat differently.
right,
There's some commonalities, but it's always interesting to see like going back to the dates thing. I love dates,
right.
and I've always heard that dates. I've heard that they don't really spike glucose, despite them being such a high sugary product.
Right.
Naturally, of course.
Yeah, they do have a
Um,
lot of sugar in them
yeah,
naturally,
but
don't
they
they?
do have a lot of fiber in them
Fiber
as
sugar,
well,
right,
so
right.
which helps to offset the glucose
Exactly. Yeah.
spikes. And one of the things that I found ironic, and I'd love to get a glucose tracker to test this for myself, but was that one of the people were like, okay, I haven't eaten in a couple hours. I'm going to eat like a handful of dates and wait a few hours to see how my body reacts. And he had no glucose spike at all. And he
Yeah.
had gone from like an empty stomach, which from my understanding, going from an empty stomach, consuming something at a high sugar content, it is that is going to lead to a spike in glucose more if you were coming in full, if you had something else in your stomach. Is that first off accurate or?
Everyone's different. I mean, some people have really good insulin sensitivities, and so the cells will say, "Yeah, I'll take in this extra glucose that's coming in." And then some bodies are just not going to listen to actually that. That's where you have the blood glucose spike.
Yeah.
And so everyone's different. Yeah.
And speaking of the dates, is there something else you want to add
Well,
to that
I
first?
have a glucose
Sure,
question too.
sure.
You're on a roll, Oz. Keep going.
No, I mean, I just got so many questions again.
Yeah.
So stop me if you want, but
Yeah.
I was curious about the role of fiber, and,
Yeah.
and maybe this will overlap with glucose. But so maybe ask your glucose question first, and then
Okay,
I'll come back to this.
so we have a lot of, and myself included,
Yeah.
we have a lot of athletes that watch our podcast, and glucose is obviously a big thing for athletes.
Right.
In sugar,
Right.
when I raced, it was always goos or gels. Anything with sugar, you get that quick hit. So how does this, what we've been talking about, how does it apply to athletes? I mean, they're burning it off. Are they burning it off right away? What happens when that glucose hits their system in the middle of a workout, for example?
Right. So you have two sources of fuel. You have the glucose and also fats. And so I refer back to the one of the big carb loading athletes, Tim Noakes. He used to be big on carb loading, and
Yeah.
after a while, his body just couldn't handle that glucose load, and he had to shift towards a fat approach.
Yeah.
And he was even a big proponent on all these extra carb reloading and extra sugars, and he developed towards diabetes, and so he had to change his approach also and move towards like a fat approach here. So our bodies have that a hybrid system where you can get the energy from glucose or fats,
Yeah.
and so we have to get their bodies just able to burn fat at some point. And
Yeah, that was kind of become a thing in the endurance world in the last 7 or 8 years, give or
Yeah.
take.
Notice that
Yeah.
too.
Before that, you really didn't hear that. It was all about sugar,
right,
carb
Yeah.
loading the night
Right.
before,
Right.
and then just preparing your body for the next big event the next day or whatever it was, your
Right.
marathon or whatever. So,
Mhm.
now on that note, you have done did you do some triathlons in the past?
yeah, I did triathlons in the past.
Okay.
Just trying to see if that will actually can improve my fitness, and
Yeah.
but I was also still doing the sugar before,
Yeah.
and that's where after that I was just either bonking or just fatiguing,
Yeah.
but at some point I just went off of that because I didn't really get I was still on my health journey, and
Mhm.
that's when I ended up the triathlons and not doing that anymore, and just focusing on other things like nutrition.
Yeah.
Yeah.
So
Yeah.
let me ask you then, what does your daily nutrition look like? What does your daily routine for exercise or movement look like for you personally?
Another good question.
I mean, for me personally, I mean, because my daily is not the same thing as other people, but
Sure. Yeah. It's
yeah, definitely.
individualized.
So in the morning, I like to start off with make sure that there's some protein, so and also some fats also. So either it's an avocado and then also if you get the protein through eggs or even like a protein shake, if something quick like that. And when you go through the day, I like to prioritize protein because make sure you have that depending on your weight. And so when you're eating a meal, I like to prioritize actually the protein first, whether it's the chicken or the fish or the meats first, and then you eat your veggies. Then you add the sugars that you add later,
Mhm.
like if you're gonna add some carbohydrates, potatoes or so forth like that.
And that is,
So yeah,
side note, that has an impact on how your body responds to the glucose, right? From the carbohydrate source, sugar,
Right.
whatever it is that you're consuming by first starting off with protein,
right,
moving to the more fibrous,
fibers, yeah,
vegetables, whatever it is.
right.
So I've heard that same as well. So that's your approach when you typically eat. Is that a mindful thing you are of every meals, or just like mainly for your dinners, your larger dishes that you're approaching
It's both mindful because I know that my blood sugar spikes if I don't eat the protein first and the
Mhm.
fibers first. If I eat the carbs first, then definitely my blood sugar's gonna spike. So
Yeah.
So you do find
Yeah.
yourself personally pretty sensitive to
yeah,
glucose spikes?
yeah.
What typically sets you off that a normal person is not as sensitive to? Is it something as simple as just like whole grain bread?
I mean, as in the type of foods, because I pretty
Yeah.
much just have been staying away from wheat and dairy
Okay.
at this point, because I just when just like going through this program myself, actually finding out there are certain foods I just can't really have. I mean,
Yeah.
I can bring the
Yeah.
dairy back in, but then I have issues with my gut. I can bring it the wheat back in, but then I have issues with my gut. So it
Yeah.
just kind of like I figured out that those are the things I have to stay away from.
Okay. So that's
So
Yeah.
you're more sensitive though. So
yeah.
the breakfast would be something like eggs, avocado. Is there any carbohydrate source in your breakfast, or is it mainly just fats and protein?
Yeah, yeah, there can be. There's like cut veggies, get some carrots, peppers, and cauliflower, broccoli, and
Hmm.
that. That's why my wife prepares. So it's all ready there just to go, either steamed or we can get raw.
Yeah.
So yeah.
What are
Yeah.
your go-to lunch and dinners in the rotation for you
Um,
personally?
I mean, sometimes I'm just really on the go, so I just have a protein shake. I
Okay.
mean, whatever what works for your body. And then, of course, the dinners. My wife's a great griller, so she cooks either the steak or even like the chicken on the grill, and then add the veggies. And
Hmm.
yeah,
So what I'm hearing, lean proteins and veggies, so
yeah,
micronutrients,
yeah.
clean proteins, and then some carbs. So your carbs would they be like berries or like
Definitely
Or
berries is part of it, and
okay.
also kind of be like potatoes, sweet potatoes, and yeah,
You do a lot of sweet potatoes?
yeah,
Yeah, I
do
love
you
sweet
do
potatoes.
you? I recently learned of this trick since you mentioned potatoes of the impacts that I believe it was glucose. Correct me if I'm wrong. Of having your starches be cooked and then cooled before you eat them, and the impact that that has. Can you talk to me
definitely.
about that?
Yeah, something with the cooling of the starches. I mean, even if you take some pasta and you put it in the refrigerator, there's some things that happen with that carbohydrates. So after that refrigerated time, it actually decrease addresses the absorption of those carbohydrates and slows that down. So
So is it that it decreases that glucose spike that typically would be come from it, or is it
yeah,
just the absorption of the nutrients and processing that it goes through in your gut is smoother, faster?
it's the breakdown of that glucose, those
Okay.
carbohydrates into smaller ones.
Okay.
So
Okay.
yeah,
Yeah, because I was hearing about that recently, and also the similar to green bananas being really good as like a resistant starch
yeah,
for gut bacteria and all of that. And we haven't gotten into the gut biome, and I know that's a realm that I've been interested in, but I know very little about. Is there a summary you can give, especially for people at home that have no idea of the influence that the gut has in your overall health? That you can kind of paint that picture of this is the influence of the gut, and this is why it's kind of a factor that drives a lot of other areas of health.
I mean, we see that the guts it's big in affecting moods, anxiety, and depression. So, and then also if the gut's inflamed, it's not going to be able to absorb all the nutrients, and so you're going to have problems there. Um, I mean, I think the biggest thing that we see with deficiencies in nutrients. I mean, if you have like for B12, it needs intrinsic factor, and so if you don't have that one, then it's not going to absorb with B12. So definitely the guts. That's a big issue. If it's inflamed, you're not going to have all that nutrients and things absorbed properly. Yeah.
And that's what's been getting me into the going back to the fiber question.
Yeah.
That's been getting me into fiber a lot more lately. One, I think it's been circulating, at least in my. I'm big into the nutrition, nerding out over that stuff to small degrees. But fiber seems to be something that is coming up a lot more often. I don't know if you've experienced that in either of you guys day to day of people talking about it. It seems to be more mainstream, for lack of a better phrase. But looking into it, what I was seeing is that the impact that fiber has on your gut is very, very positive. Obviously, people associate fiber with things like digestion, but
Mhm.
the impact that it has in your gut in terms of processing and creating the bacteria needed for your gut to thrive. Again, I'm sort of butchering this because I'm
No,
very
that's absolutely.
inexperienced, but
You're
is that
actually on
accurate?
track. No,
Good job, Austin.
you're actually
Trying
on
here.
track here. But so whatever the fiber, I mean, prebiotics, those are actually things that are actually feeding the gut here.
Yeah.
So even the sugars that are actually feeding the bad bacteria. So actually getting the right fiber in your guts actually feeding the good bacteria.
And people
So,
talk about two forms of fiber, but there's more than two. Isn't there like 4 or 5 different forms of
soluble and
fiber?
insoluble, and then
Yeah.
there's other ones also.
But soluble and insoluble are the ones that I hear most commonly.
Right.
The other forms I'm not familiar with. Is that because the insoluble and soluble, broadly
Probably the
speaking,
main ones, yeah.
those are the
Just
main ones to focus on.
yeah,
The other ones are not as
right.
impactful. So if you focus on these two, the other three would be
Yeah,
fine. Is that the
that's the
typical
main
approach?
one. Yeah.
And what types of foods do you find soluble and insoluble that are high in those?
Well, I mean, of course, you have the psyllium fiber,
Hmm.
and then also you have this all the fiber that's in veggies. So from that approach
That's
here,
going to
yeah,
cover most of
yeah,
your fibrous, those two areas.
pretty much, yeah.
And what is the main difference between soluble and insoluble fiber?
Well, it's the ability to absorb, whether it's absorbed through the gut. Some of them don't get absorbed through the gut, and
Okay.
mm, yeah,
So it's the compound of those two just helping with absorption and
right.
nutrients and breakdown. And
Yep, some of those compounds just pass through the gut and bring in fluid into the gut.
yeah.
All those compounds actually gets absorbed into the gut. So
Okay.
yeah.
Awesome. I like that. There was a question I told you to remind me of, and
You said come back to it.
I don't remember
You
what
didn't
it
tell
was.
us what it was, so we don't know what to tell
I
you to
thought
come
I
back
gave it
to.
something. That's all right.
Fiber.
Was it fiber? I thought it was something
See,
to do with
Justin's
fiber.
listening.
Maybe I already asked it then. Maybe I already tackled it. Well, after everything you've told us, your practice, your day to day, if someone's listening right now and is like, okay, this is interesting, what's the first step you would recommend that they take? You talked about spoon feeding, breaking it down in little stages for them to, so that it doesn't seem as overwhelming up front. If
Right.
someone's listening is like, man, that sounds interesting. Where do I start?
Yeah, I would start off with the processed foods. Anything that comes in a package, and just cut that out of your diet, and that's where I'd start.
And it processed, you're defining that simply as anything, in the middle aisle of a, grocery store.
Definitely, middle aisle, stay on the edges.
Packages. Yeah.
Right,
Okay.
right.
So that alone will create a big enough domino effect where, people
That's a start.
listening are like, okay, if you start doing this alone, you're going to see and feel some differences that
Yeah,
hopefully will trickle down into exploring other areas and starting to take those next steps.
right.
What about
And
along this? Oh, go ahead. Did you have more to add to
go
that?
ahead. Yeah.
What about exercise? Because a lot of people listening, maybe some people exercise all the time, but there's, of course, a lot of people listening too that are like, well, I went for a walk 2 weeks ago. I walked my dog kind of thing. So that's not in their normal routine. So what would you say for the average adult? Like what's a minimum entry level, like a certain minutes per day, a certain number of days per week? Like,
If you can do 20 minutes a day, at
okay.
least 3 times a week, or even just do some activity and just some housework.
General
Just
movement.
keep moving. Yeah.
Just
Mhm.
move your body.
Yeah, just move your body. Get
Yeah.
off that couch. Yeah.
Yeah,
The-
that reminds me of the lived. I think I'm saying this right. The documentary "Live to 100."
Yeah.
You know the one I'm talking
I'm
about?
familiar with
Yeah.
that.
Talks about blue zones and whatnot, and it's a lot of the people they interviewed that were centurions that were over 100 years old. They were just moving their bodies constantly moving. So that was one of the biggest things I took away from
Yeah.
that. So,
Yeah.
and obviously it's one of your pillars.
Yeah.
Yeah. On that topic, are there any for the average person, again, not as well versed in doing the research, the studies and diving in, were there any more mainstream documentaries, things that you've watched or read books that you're like, wow, this actually encompasses a lot that I think is really digestible for the general population? Is there anything like that you've come across that stands out to you that maybe other people could check out?
There's something that's recently, there's a cholesterol code. If people are interested in that. then
What is it again?
cholesterol code?
Is this a documentary? Is this
It's
a
a
book?
documentary
Okay.
that's just come out recently because a lot of people are pushing the statins for high cholesterol. So
Mhm.
just take a look at that along with the cholesterol myth. There's a book that's out there. So
Is
actually,
it just talking about how the cholesterol levels are maybe redefining how we look at cholesterol in terms of assigning it because I've heard a little bit about cholesterol sort of anecdotally in some conversations on how high cholesterol, either the marker that we're using that states this is the threshold that's considered high is off, or that our understanding of cholesterol being high we're expanding that knowledge. Is it one of those two?
it's the understanding what cholesterol's role is and the way that the industry is pushing towards medications, towards statin to fix that. When there's really not that much benefits for the general population, it's good for cardiac patients who had heart attacks, but getting general population on that for preventative, I can go back to Dr. Malhotra, and he's the big thing that's really proponent against this, putting everyone on statins. So that's a big thing.
Okay.
Yeah. So a
Interesting.
cholesterol code
Yeah.
and the cholesterol myth book. So
Okay.
that's a big one.
That's
yeah.
good. That's good. There's one last question I had because I remember what I was going to ask.
Oh,
earlier.
you came back to it. All
It's going to
right.
be totally random.
Sure.
And feel free to tell me no if you don't have enough background or understanding of it, or I read something about GLP-1, and it was really interesting. And I think I don't even know if it's considered a theory. It might still be just considered a hypothesis, but was that GLP-1, from my base understanding, works on the reward and motivation circuits. And as a result of that, it can be a prescription to not only just weight loss, but for things like anything addictive related. So I've heard its impacts on, people that have drug addictions, alcohol, whatever it is, gambling. I've even heard it being potentially used as that helps to remedy it. But I've also heard recently that there are some potential concerns over how that blends into the area of romantic relationships and how that has an impact because of the circuits that it works on. Correct me if I'm wrong on any of this, please. That we may be having individuals on this drug will see reduce in desire for the need to bond or connect with a partner. Let's say, for example, and I'm butchering how this was worded because I can't remember the phrasing in the article I was reading. But one, does that sound familiar to you at all? And am I off mark on how I'm describing
I've not heard
this?
that. I've heard more of the side effects of GLP-1. I mean, it definitely addresses society for not having that hunger pains, and definitely more of the side effects of weight loss from the muscle mass, and you have the hair loss, and you have the flaccid areas in the face, and even the pelvic area.
Mhm.
That's not really talked about, but that's I've never read that article. But
It's interesting. Maybe
yeah.
if I find it,
Sure.
if I find it again, I'll send it to you because I'd be
Yeah.
curious to see what your thoughts are on something like that.
Yeah.
I read it and I was like, that's really interesting. The reward, them using it for drug addictions, things like that, and finding success rates. So if I find it, I'll send it over to you just to get your thoughts afterwards on it. But that's mainly the last question I wanted to throw for Lube. Was there
Well, at least
anything you
you
wanted to
remembered
add?
it. I do have
Yeah.
two things. One of them is I had a question, doctor, in regards to I read an article, actually two articles recently being in the last few months about as you age, how important it is to not just do endurance training, but build a little bit of strength training in there. The article talked about testosterone for men, but it really actually both articles touched on the fact that if you have lower body strength specifically, you have more balance and you're less prone to falling. Because as we all know, a lot of people know, as you get older, if you fall, if you break a hip, especially as you really start to age, sometimes you can't come back from that. So, what's your take on placing some level of strength training, and this is a two-part question, and specifically lower body strength, at any age, or especially as we age?
Yeah, there's definitely some truth in that. And this is what I see in the nursing home. Every time I go there, you have
Mm.
these patients that fall and they have a
Yeah.
hip fracture. That's because over time they've not been maintaining or even building that muscle strength, and that's important to avoid those falls here. I mean, you have a patient standing up from a cane to a walker to actually on a wheelchair, and that's the progression that people are heading if they're actually not maintaining that muscle mass, actually doing some strength exercises. I mean, you probably heard of a big thing that they're pushing like Tai Chi just to get that balance.
Mm-hmm.
And
Yeah.
so definitely, as we age, we should be still maintaining our muscle mass, doing some exercises, some activity, whether it's walking, whether doing strength resistance and resistance training. So that's definitely a big part of
Yeah.
aging. If you
Yeah.
neglect that, then we end up in the same situation where what I see in the nursing home with falls and
Yes.
hip
Yeah.
That makes
fractures
total
and
sense. Yeah.
yeah.
It's funny
Yeah.
because I heard and you're hearing so much about, we have a doctor here and you're just hearing two inexperienced people keep saying, I heard this. What about
Yeah.
this?
Yeah.
We're just riffing off of things that are probably not true or half truths. So we're using you as a filter system. So I
No.
appreciate you being.
And then what happens when you go in the nursing home? They actually do the physical therapy.
Yeah.
Yeah.
So if you have the clients that are not motivated to actually be there, then they're just going through the motions with the therapist, and it's like you're just like doing the motions, but you're not actually putting some effort in.
Yeah.
So
Yeah.
it's really important to actually start early, get that
Yeah.
training in early, so you're doing these exercises and movements, and you're familiar with that. And so as you get older, then you can use that to actually maintain that strength.
Yeah.
Yeah.
Simon Sinek is an author. He's got his own podcast. He's really fascinating, but I heard him say one time that I don't know how popular the study was, but there was a study that was done that the three most important muscles that help to determine longevity are heart, lungs, and the third one was your leg muscles. And
Yeah.
it kind of ties into what you were saying. And the
Yeah.
reason why I think that they were finding that the leg muscle was so important, one, because movement, having the strength in your legs to be able to move like you're talking about from a young age to an old age has a domino effect in a lot of areas of your just overall physical well-being and health. But also too, the social elements that come with being able to physically move are far more abundant. And so that social factors, but also the physical factors make it a massive kind of driver to longevity for a lot of individuals. So I just thought of it tied to this conversation that you were mentioning. So I wanted to make note of it, but okay, we picked your brain and ear off on a ton of things. I really appreciate you letting us do that. But if people want to follow along, they want to jump
Wait,
into.
before you get into that,
yes,
I
please.
almost forgot something. Hold on.
Go for it.
We didn't want to forget this, Doctor.
Okay.
On RP39
Nice.
company, we sell orange mud products. This is a gift to you,
Oh, thank you.
and this is their hydration pack. It's a kind of a minimalist hydration pack.
Yeah.
So when you go on your next runs and hikes,
Okay.
you can put your phone in here, water bottles in there. There's a hydration pack,
Very
of course, in
cool.
there. So we wanted to gift that to you for
Thank
taking
you.
the time out of your busy schedule to come and see us and
Yeah.
Yeah.
share your knowledge with us and
Okay.
then listen to us ramble a little bit
Yeah,
too.
yeah,
No
yeah.
problem.
But,
We greatly do appreciate your time
Yeah.
and effort into this.
and we
sharing
hope
with
that
us.
people,
Yeah.
we really hope that they take your message to heart.
Yeah.
And if they've been thinking, if you're listening, if you've been thinking about making a lifestyle change, man, today is the day.
Yeah.
Do it right now.
Yeah.
So
And starting small, not getting caught up in the overwhelming, well, you got to do this, or you got to take 10,000 steps a day. You got to actually cut out all this and
Right.
don't eat carbs, only eat fats.
Right.
It's so easy to get caught up in the noise. And this is just from my personal experience. Like everyone's trying to over optimize and you're hearing messages over here and over here.
yeah.
And, take these supplements every day. You have to, because it counteracts these things. So cutting out that noise, starting super simple, like you mentioned, just cut out processed foods.
Right.
Or start moving 20
Moving your
minutes a
body.
day,
Yeah.
Yeah.
I love that suggestion. It's digestible. It's easy, digestible, maybe a pun intended in there. It's easy and simple for them to take on and be like, okay, this isn't this massive undertaking. I don't have to think about all these components. Let me just do this one thing today.
Right.
And they'll start to see that domino effect, the compound effect, et cetera, and all that. So I appreciate you kind of unveiling that. And if people do want to dive in, they're like, okay, this is interesting. Where can I contact you? Where should we direct them to?
Yeah. You can look at the website, galerahealthwellness.com.
Okay.
And definitely you can, it's there in the web. You can do a search. So,
Perfect.
Yeah.
Yeah, we'll put it in the show notes so
Yeah.
people have access to
Yeah.
it and they can jump in. But thank you again for taking the time. Appreciated the conversation. And
right.
Hopefully we'll do it again. We'll pick your
Absolutely.
brain some more. And
Thanks.
bother you.
Thanks for having me here.
Thanks,
Yeah.
Doctor.
Yeah.
Yeah.
Appreciate it.